I will be doing the anterior and posterior glides. These are testing the laxity in the carpal joint. For this, you want to have the patient sitting in a stool, sitting up straight, with their forearm resting on the table. You want to stabilize the distal end of the radius and ulna. You want to grab around the carpal bones, load the wrist, and shift the carpal bones anteriorly and posteriorly. Positive results for this test would be increased movement from the bilateral side. I will be testing varus and valgus at the wrist. These are testing the collateral ligaments. For valgus, you're going to apply you're going to put their hand in a fist just to make it easier to move them. You're going to apply a valgus force to the wrist, which is testing the ulnar collateral ligament, and then applying a varus force to test the radial collateral ligament. A positive test would be increased laxity from the bilateral side and possible pain. The Lynch-Dye test is testing for laxity in the carpometacarpal joint. For this, you're going to stabilize the base of the metacarpal and try to move it superiorly and inferiorly. You're going to see increased movement in the fourth and fifth fingers. This is normal, but you should compare bilaterally to see what is normal for the patient. I will be doing the scaphoid shift test. This is testing for scapholunate instability. It is also known as the Watson test. For this, you're going to put the patient into ulnar deviation. You're going to locate Lister's tubercle and the scaphoid. You're going to load the wrist and move them into radial deviation. A positive test would result in pain and feeling a clunk. I will be doing the pisiform shear test. This is testing for instability of the pisiform. For this, you're going to hold the pisiform and try to translate it on the triquetrum. A positive test would be increased movement compared to the bilateral side. I'll be doing the TFCC load. For this, the patient will be sitting. Their forearm can be in pronation or supination. For this, you're going to want to stabilize the distal radius and ulna. You're going to put them in ulnar deviation, grab around the carpal bones, load the wrist, and shift anteriorly and posteriorly. You're going to compare this bilaterally, and a positive test would be pain and increased movement from the bilateral side. I will be doing the piano key sign at the wrist. This is testing for radio-ulnar joint instability. For this, you're going to stabilize the ulna, stabilize the distal ulna, and try to translate the distal radius from the ulna. A positive test would be increased movement from the bilateral side. I will be doing the Fallon test. This is testing for carpal tunnel syndrome. For this test, you're going to have the patient put the backs of their hands together and then drop their elbows. You're going to have them hold this for 1 minute. A positive test would reveal tingling and numbness in the median nerve distribution, so the thumb and first 2 fingers. I'll be doing the reverse Fallon test. This is also testing for carpal tunnel syndrome. For this, the patient is going to have their palms together and drop their hands. They are going to hold this for 1 minute. A positive test would be tingling and numbness through the median nerve distribution, the thumb and first 2 fingers. I will be doing Tinel sign at the wrist. This is testing the median nerve. For this, you're going to tap the cubital tunnel. A positive test would be tingling and numbness through the median nerve distribution, so into the thumb and the first 2 fingers. You're going to want to tap for at least a minute. I will be doing Allen's test for patency. This is checking the capillary refill in the hand. For this, you're going to have the patient make a fist and open and repeat this 5 times, and on the 5th time, hold their fist. You're going to put your thumbs over the radial and ulnar arteries and then have the patient open their fist. You're then going to release one of your thumbs and see how long it takes for the blood to refill the hand. You're going to know because when the patient first opens their hand will be white, and after you release a thumb, the hand will begin to get red again. And you're going to want to count the time it takes to do this. You're going to want to compare this bilaterally, comparing both the radial and ulnar arteries. I will be doing the Finkelstein test. This is testing for tendinitis or tenosynovitis in the first dorsal compartment. This is a passive test. Can I have your arm, please? You're going to stabilize the wrist, have the patient put their thumb inside of a fist, and then you're going to move them into ulnar deviation. A positive test would result in pain.